When the pandemic first hit a year ago, we were somewhat immune to it, if you will. We didn't see the big numbers, and we were cautiously optimistic that maybe we could get through this unscathed. And then the winter came and the second wave came. The number of people that were hospitalized was devastating. The number of seniors in our nursing homes, the number that passed, it was just tragic to see the impact that this has had on us.
The scale of this is global, and it really is eye-opening, and it's taken all of the things that we did every day, the regular maintenance of care and provision of care to the community, and had us then to prioritize, not push aside, but be able to address the immediate need, and that was that we had a contagion that was quite good at making people ill, and in many cases could make you a statistic. Not only were the patients contagious, but we could be as well, and we knew that 30 or 40% of coronavirus was asymptomatic. So the fact you felt fine didn't tell us that, so we had to deal with everybody, even our colleagues, as though we all had it.
The role of our staff has been nothing short of amazing. They have really adapted to changes that have had to occur at the bedside with our patients. So not only are they the clinician in that work environment and providing care, treatment, and services to the patient, but they've also had to step in and be the surrogate, if you will, for the family and the patient. And so, we have done things with technology in terms of using iPads to FaceTime with family members, and the staff have been instrumental in making sure that those interactions could occur with our patients. But we've brought life into the world in this time of pandemic, and we've also held the hands of those patients who are dying. And so we've been the comfort for the patient when the family can't be there. And so that's been very challenging, because you go from the person who is saving lives to the person who is helping a patient put closure on their life. And so that has been very, very difficult for our staff.
There's an old saying that it's easy to be a good sport when you're winning, but the real sportsmanship happens when you're struggling. Yeah, and I would say we struggled.
It's difficult when you're trying to manage the care of patients, but you're also trying to manage the care of your colleagues. It was very hard for us as an organization to watch our colleagues get ill. We watched not only our colleagues, but loved ones of our colleagues get ill. Some did not make it through their battle with COVID. And so those things have been very, very hard and very difficult. Certainly, I believe that our colleagues are resilient. They come to work every day, they do their job, and they do it with grace and professionalism. And I think that it speaks volumes for the character of all the colleagues in the organization. There was a lot of fear here. We dealt with something that we've never dealt with before. There was a lot of learning and a lot of education, and there was a lot of concern about what we were taking home to our families.
Our community, they rallied immediately. Yeah, we received phone calls and letters and donations, and we had a lady in Ashland who sent me a letter that said she didn't have the wherewithal to send a cash donation, but she committed to making masks. We had corporations reach out to us, give us N95 masks. Local restaurants who honestly were struggling, quite frankly, themselves. They were shut down. They had no income, and yet they were making pizzas and macaroni and cheese and other things for us. Our community was here for us each and every day, and continues to be.
To get a letter from a patient that said, you're our heroes, you are phenomenal, you've saved my life, or you were there to comfort my family member when in their last days, that's more meaningful than any gift anyone could ever give. To know that you've been able to touch a family member, to touch a patient, to touch a colleague's loved one in their time of need is certainly something that helped all of us get through this pandemic. And I think that it really has gone a long way to boost morale, to let the staff know that they're appreciated, that their work has not gone unnoticed, and that what they do is important to not only us as an organization, but our community at large.
Gilberton had a devastating flood. We went up there, as we had in the past in other floods, and set up a tetanus clinic and provided information about safety, provided some free first aid supplies for that community. We provided 4 AEDs to the Boy Scout camp. Proud to partner with the Boy Scouts. We also partnered with our local borough of Port Carbon. Again, didn't have the wherewithal to replace expired AEDs. We bought one for the police and one for the fire department. We started the first ever EMT training program within a high school. And when we were setting up the program and providing the funding, we thought, if we got 10 or 15 kids, it'd be phenomenal to start as a volunteer EMT. We got 35 kids in the first class.
There was a sincere gratitude, and I would say probably the greatest kudo we got from them was a confidence that if we said we had it, they'd move right on. If we asked for something, there wasn't a, well, do you really need it? It was, how do we get it to you, and so forth. So I would say that it was probably the biggest kudos. On top of it, our senior leadership was up here. The president and CEO, Brian Nestor, came up in the middle of the pandemic and actually walked around thanking people. And that wasn't by accident. He felt very strongly about coming up and doing that. So we saw not only them virtually, but they also invested the time to come see us.
So Dr. Nestor will be joining this video to talk to us about his gratitude as the president and CEO of Lehigh Valley Health Network. I can tell you that every time he speaks to us, he sends a message. It resonates how proud he is to be the leader of this network, and how proud I am to be a partner with him to be able to deliver healthcare to this community.
On behalf of our board of directors, our executive leadership team, and most importantly, our patients, I have a special message for all of my colleagues in Schuylkill County. The message is this: thank you. Every day since you joined Lehigh Valley Health Network, you have worked tirelessly to make our health network stronger and our community healthier. You live and breathe our mission and values. You heal, comfort, and care with compassion, integrity, collaboration, and excellence. And you create moments that matter for our patients and their loved ones. Whether you provide patient care or support those who do, every colleague plays a critical role in our mission. Thanks to you, people in Schuylkill County know that when times are tough, the LVHN family has their back. They take comfort in knowing they have a team of healthcare partners on their side to guide and help them through their health journey. As we move forward together, let's keep delivering better and better experiences for our patients and their families. Unquestionably, you are making a difference in people's lives. For that, you should be LVHN proud. And for you, I am thankful and grateful. Keep up the good work, and from the bottom of my heart, thank you for all you do.
I can't think of anybody that I don't want to thank, because every day you were there helping us where we could and doing those things that we needed to do, and we knew we could depend on you. And just amazing, and special shout out to the nursing staff. You were through hell. Sincere thanks, Lehigh Valley Schuylkill, for all you did for the community, for the patients, for all of us. Thank you.
I would just like to take a moment to thank all of the colleagues at LVHS. You are amazing. From the individuals who care for patients at the bedside, our providers who offer their care, treatment, and services for our patients, all of our ancillary support teams, our housekeepers, our EVS folks, our dietary folks, everybody who impacts the care of a patient from the minute they walk through the door to the minute they go home. I'd like to thank you from the bottom of my heart. We could not have gotten through this past year without you. You're amazing, and you should be so proud of the work that you've done.
So I'd just like to let the colleagues know that, I've watched their eyes, I've watched their actions over the last year, and I've watched their dedication and commitment to our community. And I saw fear, and I saw dedication. And I was proud of them, really, really proud of them for what they did each and every day. They came in, they took care of our patients, they were scared, they were worried about taking the disease home to their family, and yet they were here every day. I just can't tell you how proud I am of each and every one of you.
Thank you, Lehigh Valley Hospital Schuylkill. You rock.